If you have been dealing with pelvic pain, tension, deep hip pain, tailbone or back pain, we're going to be going over perineal massage techniques that you could do at home that could give you relief. Hi, I'm Dr. Melissa, and today we're going to be going over briefly the anatomy, just so you have an idea of what structures we're targeting in your pelvis and how everything is connected. Then we're going to be going over 2 perineal massage techniques that you can do at home, as well as an added bonus at the end, one of my faves, a deep hip rotator release. Okay, so let's take a look at the anatomy of your pelvis here. Here I have a female pelvis. So your perineum is this area right here between your vagina and between your anus. And for males, it's gonna be that area between your testicles and your anus. And as you can see, everything is so closely related. We have our sit bones here on either side, and lots of muscles attach into that area and can affect your pelvic floor. And then if I take these superficial pelvic floor muscles out, you'll be able to see those deep pelvic floor muscles. Our hip, here's our hip socket right here, one of your deep hip rotator muscles, we're going over a technique for this at the end, your obturator internus, that muscle attaches into our pelvic floor. So it shows you right there the connection between your hip and your pelvic floor. If something is tight, it's going to affect both of those areas. And then if we take a look here inside the pelvic floor, you're going to be able to see how all of those muscles attach into your tailbone area. And it's all of our connective tissue and our fascia. If you imagine your fascia like a bodysuit that you put on, and it wants to glide and move and slide in all different directions, but if something's restricting it or holding it back, or it doesn't have the hydration that it needs, lots of tissues in this area can be affected. So now that you have a better understanding of the tissues that we're going to be working on, let's go over those 2 releases for this area here, your perineal massage, and then we're going to go over that deep hip rotator release at the very end. All right, let's jump right into those release techniques. If you happen to have some pillows, some blocks, a towel roll rolled up, or a tennis or a lacrosse ball, go ahead and grab those. You don't need all of them. I'm gonna offer you lots of different options just to find what works best for you. So the first position that we're gonna work on is just taking our 2 fingers right over our perineum area, and it's light pressure. You're not digging down real deep. There's lots of nerves in this area, so it's a very sensitive area. You might feel a little bit of sensation or a little bit of discomfort, but definitely not pain while we're doing these exercises. This first one you can do propping yourself up in bed, or I'm gonna use my yoga blocks and some pillows, because that's what I've got here. And then laying down on your back. You want your head nice and relaxed. You want to be breathing out to the sides of your rib cage, and just let your knees open up. And we're taking those 2 fingers and placing it right on that perineum. Gentle pressure. With all of these techniques, 30 to 60 seconds is perfect. More is not necessarily better, because the more you hydrate those tissues, we're producing that hyaluronic acid, and it can just create too much fluid, so those tissues are stiff. We want just enough to let our fascia to glide back and forth nice and smooth. So this is an option, breathing into it right here. Another position that might be a little bit more comfortable for you is laying on your side with this. So maybe using a pillow or a block to kind of prop yourself up. You're going to keep one knee down on the ground. The other leg can open up. Same thing, just placing that gentle pressure right over your perineum and breathing into it nice and soft. You might hold or do little circles, gently moving forward, backwards, side to side. See what feels most comfortable for you. Another option that you could have is bringing one knee in towards your chest and then reaching back around from behind and coming from that direction. Maybe this might be a little bit more comfortable for you. We want to soften, breathe into it. As you're breathing in, feel the pelvic floor muscles pushing into your fingers. Gentle relaxation there. Just be nice and soft. So about 60 seconds, 30 to 60 seconds. See how your body is responding to that first. So that is our first technique. The second technique that we're gonna do, you can use sitting in a chair if you had an exercise ball. We're gonna grab that towel roll and roll that right up and place it in between our legs. So we're placing it right over that perineum. Kind of thinking from pubic bone to tailbone is where you want that. You could use a yoga block like I am. You might want a little bit more cushion or something softer. If you had a bolster, you could sit on a bolster for that. We're gonna work on just gently tucking that tailbone underneath, and then rock your pelvis, come forward up onto it, breathing. Send your breath down nice and soft. And again, nothing should be painful or recreating your symptoms. Good. That slight, oh, this is a little uncomfortable, that hurt but feels good type of feeling, and you should feel the tissues soften and release as we're creating all that hydration, getting our tissues to be able to glide back and forth. We don't want our upper body moving with this. So we want to make sure that it's just our pelvis gently tipping forward and then gently rocking backwards. We're staying with the breath, breathing out into the sides of your rib cage, being nice and gentle, rocking forward and backwards. The same thing with this exercise, 30 to 60 seconds. See how your body is responding and feels. And I would pick one of them to start to see which one works best for you. Build yourself up over time, and maybe you could do both of them, or you find one that might be more helpful. If you notice that you tolerate that 1 minute well a couple of times a week, you could maybe start to do that a couple times during the day. But really listen to your body, that's most important. So those were our 2 perineal releases that we were going to do. And now one of my favorite hip rotator muscles. We saw how in the pelvis, that hip rotator muscle connects into our pelvic floor. So I'm gonna show you a technique. You could use the towel roll. This will be a little less intense. And then I have, this is softer, like a tennis ball consistency. So you can take 2 yoga blocks. You could also do this sitting in a chair as well. And we're gonna take the ball and place the ball right in between our sit bone and our tailbone, because we had seen how inside the pelvis, all those muscles connect right in between the sit bone and the tailbone. So finding that comfortable position sitting. So we don't want the ball going up into any holes here, but just so you can see, that's kind of like that area that you want it to be in. We can start on the right-hand side with these. Whether you're sitting in a chair, using your yoga block, sitting straight on the ground, just to the inside of that right sit bone. And we're gonna breathe. Try to soften, breathe into that. Just goes to show how everything is so connected, and that it's not just one isolation of a muscle group that we're working or a hip joint. We're trying to get our whole systems working together. You could maybe let that right knee fall out to the side and bring that back in. You can maybe do that gentle rocking forward and backwards over the ball, finding that right spot. Maybe the leg comes out in front and we just do a little straighten and a little bend. The same rules apply, 30 to 60 seconds with this spot. And again, it shouldn't be that painful hurt, but that like, woo. I know that's there, but this is that hurt, but feels good position. I love to do this one maybe before I go out for a run, after I do a run or a workout. It's great to just help release some pressure and tension around your tailbone area and your hips too. Okay, now if you want to go ahead and try that on the left-hand side, and just noticing the difference between left side, your right side. With all of the techniques that we did today, 30 to 60 seconds is a perfect place to begin easing your way into it. We want to make sure that we're not gripping, holding any tension, that we're breathing out to the sides of our rib cage, softening into it, not having any pain when we're doing these exercises, but just finding that ooh, this is a little uncomfortable, but feels good spot. And you notice that softening happening over time. Starting with one of these techniques and then building yourself up. It's great to do them 2 to 3 times throughout the week. And remember, less is more, 30 to 60 seconds in each spot. If you're finding that you need a little bit more attention or one-on-one work, finding a pelvic floor therapist in your area can be really beneficial. And also, I offer my pelvic floor playbook class where, how I talked about in the beginning, everything is connected. I break things down step by step to help with pelvic floor dysfunction and get you back to the activities that you love and enjoy. If you found this video helpful, let me know down below in the comments if you want more tips like this. If you're new around here, hit that subscribe button. Keep up the good work. Until next time, namaste.